to all of those joining us live and to those listening to this afterwards. I'm very pleased to welcome you to this FIP webinar, Vaccination, Benefits Beyond Specific Disease Prevention, Part 4. My name is Lina Badr. I'm the FIP lead for Equity, Sustainability Policy and Development, and I'm very pleased to be moderating today's webinar and discussion, which will be included later. Just some housekeeping rules and announcements. This webinar is being recorded and live streamed via YouTube and is freely available to everyone. The recording will also be available on our website, events.fib.org. You may ask questions using the question box provided. You are welcome to provide feedback to webinars@fip.org about any issue or topic. We look forward to hearing your feedback. And finally, if you aren't already, please do consider becoming a member of FIP, and you may find out more about membership benefits on our website. May I also alert you that this webinar is being interpreted live to a few languages, and you may jump on that channel through the button in the control panel of the Zoom control board. I wanted to also start with a quick acknowledgement that this webinar is sponsored through unconditional funding by GSK. Today's learning objectives, very simple but very important. We will summarize some key take-home points from the series thus far, and also present some new educational resources by FIP on the topic, as well as existing ones. We want to discuss with our panelists some of the downstream impacts of vaccination, continuing and building on the discussions that have ensued before in this series, and also end with focusing on some actions and priorities for pharmacy and FIP. Just a quick recap. The series started back in August of this year. In part one, we delved into the technical and evidence-based insights on positive downstream effects of vaccines in older adults, including that on cardiovascular events and diseases, diabetes, or arthritis. Part two took place a few days after, on 31st of August, where experts shared contributions, activities, tools that pharmacists lead and utilize to promote healthy aging in the practice setting. That webinar also highlighted the varied but crucial role of pharmacists in vaccination, particularly again for older adults, and supporting patients' quality of life. The third event took place last month on the 13th of September, where we focused on enhancing the understanding of disease burden and vaccination impact, strengthening resource utilization and implementation strategies, highlighting proficiency in vaccination management through case studies were among the issues discussed. And today, I've run through the event objectives, but I wanted to let you know that we are preparing summaries for part 3 and 4, which will be published soon. This was intended to capture some of the key insights and rich discussions that took place during the panel discussions of those two events. The first two events focused on educational presentations and technical knowledge, and the last two feature interprofessional or intra-professional discussions. Without further ado, I'd like to introduce our first panelist, Dalia Bajes, who will be talking us through supporting pharmacists in the area of vaccination, and telling us about FIP's initiatives and activities so far. Dr. Dalia Bajes is the lead for FIP for provision and partnerships. She comes from a background in pharmacy practice and academia. She's a registered pharmacist in Australia and has a PhD in pharmacy education and training from the University of Sydney. Dalia, thank you for joining us and welcome. The floor is yours.
Thank you so much, Dr. Lina Badr, for this kind introduction. I'm just going to share screen. Kindly confirm that you can see it appropriately and correctly. Thank you so much. Lovely. Thank you so much, Lina, for the kind intro again and for setting the scene for this event. I'm delighted to be joining you today and our esteemed panelists who I've had the pleasure of actually working with in the previous initial two parts of this series. So I'm delighted to be able to join today just to set the scene on how important the area of vaccination in disease prevention for FIP and the global profession of pharmacy. And I thought I would take our audience on a journey to describe FIP's mission to advancing pharmacy and the way that FIP advocates for vaccination and the importance of vaccination in all nations, regions, and globally as well. So I'm privileged to kind of maybe also remind ourselves and those listening that FIP's mission is to advance pharmacy worldwide. And we do this in partnership and in collaboration with our members and the wider profession at large. And FIP is a home for healthcare professionals in pharmacy from practice, science, education, and workforce. Probably the only, if not the only, non-governmental organization that brings in the practitioners, the scientists, the educators, all under the one umbrella. And by that, we really leave no one behind, ensuring that we all work together and in collaboration and really breaking down the silos that we might find ourselves into in different parts of the world. And we truly believe that there can be no pharmaceutical care without a pharmaceutical workforce, and that we can only have that achieved by having the scientific underpinnings, by having the practice empowered with pharmacists and teams with the right competencies and the right proficiencies to be able to deliver appropriate patient services. And many of you, if not all, are familiar with our roadmap to delivering the advancement of pharmacy worldwide. And that is the FIP 21 development goals. They span 21 different areas, but I can assure you, as you would have heard from so many of our events and throughout all of our advocacy work and statements, that these development goals are all interlinked. They are a key resource to transform or for the transformation of the pharmacy profession globally, regionally, and nationally. They link up to the United Nations Sustainable Development Goals. They align with the global health imperatives of FIP and the World Health Organization. We with this roadmap, it's a guide for us to transform pharmacy, and we also appreciate that different nations around the world might be at different spaces in that advancement. But we believe that we can do this together. And we believe that it's imperative, again, to bring the science, the practice, and the workforce education needs together into one transformative framework for our members and the wider profession to really set out the goals for development for the next decade. Each of the goals is comprised, not surprisingly, of practice, science, and workforce elements. Again, bringing us all together to achieve those imperatives, making sure that each element from each one of those development goals has the tools, the structures to facilitate and support the process of transformation, because transformation is a very big word, but also it's not achievable. We can definitely, we have examples of those at FIP, which is not the thing I'm sharing with you today. In addition, we really want to highlight the official relations that FIP has with the World Health Organization, the fact that we are collaborating to address global health priorities in the areas of, and not inclusive only of, patient safety, antimicrobial resistance, medicine shortages, strengthening the pharmaceutical workforce, access to safe and quality medicines, and non-communicable diseases. We are committed to our role as pharmacists to advance primary healthcare, to achieve universal health coverage. And FIP has made that commitment when FIP signed to the Astana Declaration on behalf of the profession to ensure that pharmacy is at the forefront, contributes to the delivery of universal health coverage by 2030 through our collective role in primary healthcare. And to achieve that, FIP has recently been focusing on three main areas, which are non-communicable diseases, safety, and prevention. The yellow circle highlighted on your screen, which is what is the crux of what brings us here today to discuss vaccination. FIP generates evidence and data through the FIP Global Pharmaceutical Observatory. And this is an area that allows us to focus on the priorities and needs of our members, underpinned by technology, regulatory practices and advances, and educational reform opportunities. We also engage with our partners in the field, and we also are planning to engage more with health ministers from around the world to present evidence of impact coming from FIP and its members and all of its activities and initiatives in this area. From the 21 development goals that I presented earlier, there is one specific development goal, number 16, communicable diseases. On your screen, you see it written in different languages. And whilst this development goal sits as number 16, it links to a lot of the 21 development goals, because it really does link to how we work together, which is another development goal, to academic capacity, to early career training and development, to advanced practice, to leadership, to sustainability, to equity. And so it really sits at the heart of the 21 development goals. And as I said to you earlier, not a single development goals can function in its entirety by itself, but only when we are linking it to the others as well on this journey. And as I mentioned earlier, each development goal is, if you like, composed of three elements: the workforce and education element, the practice element, and the science. The workforce and education element is one that looks at the education and training infrastructures available to develop the workforce, a proficient and competent workforce prepared for the delivery of today and tomorrow's quality services to our patients. And then we have the practice and the science that also look at respectively strategies and people-centered professional services for the prevention, surveillance, management, and therapeutic optimization of communicable and vector-borne diseases, and with the science elements on capacity to monitor and respond to communicable diseases with innovative approaches for prevention and treatment. Therefore, I'd like to share with you that FIP's work on vaccination in particular is based on the conviction that improving vaccination coverage and promoting life course approach to vaccination are global imperatives to which pharmacists can greatly contribute to. So as I mentioned to you, of the 21 development goals, number 16 links up to at least 17 others, which really indicates the high priority vaccination holds, not only for pharmacy and FIP, but also for global health. With adequate training, I'm sure you'd agree, with adequate training, pharmacists are competent to perform a series of roles that can significantly contribute to improving vaccination coverage, from providing evidence-based advice on vaccines and addressing vaccine hesitancy, to administering vaccines, managing vaccine records, documentation. And although pharmacists have varied roles in this area in different nations and different communities, with the right set of skills, pharmacists are able to fulfill a lot of these roles as well. And so this is what brings us here today, the role of pharmacists in vaccination beyond just prevention. And this is what the previous, if you like, the previous events from this series have actually highlighted, which is of paramount importance. And I'm sure that you would really appreciate the discussions that are going to take place with our colleagues, our experts in the panel discussion. But let me share with you the ample resources that we have on vaccination at FIP. We have a dedicated microsite on our website that is a resource or a hub, if you like, aggregating FIP's publications, examples of partnerships, events, which is still a growing library in the area of vaccination. And really, they are there to support you, to support us, to support the members and the wider profession around the world in promoting vaccination awareness, confidence, and the expansion of vaccination services or coverage globally across all ages and all population groups. I invite you to explore the microsite, which I will walk you through some part of it now briefly, considering the time that we have today. On the microsite, you would be pleased that FIP's publications library, let's say, if we're talking about publications and advocacy work, ranges, and it goes back to 2011, if not before, providing an array of advocacy tools, global data, guidelines, and practice support tools. And there are also member-only advocacy toolkits, for example, to support our member organizations work in the area of implementing pharmacy-based vaccination services. We provide varied collections of evidence, guidelines for the development of vaccination services. We provide survey reports on the evolving roles of pharmacy in vaccination. We even have work in the area of regulation. So there is a regulatory self-evaluation assessment tool for advancing pharmacy services as well. The publications that you see on the screen and are presented on the microsite are presented in chronological order. I invite you to go in there and have a look at those publications and events in more detail. Additionally, FIP obviously organizes digital events on regular basis, webinars, to highlight different topics related to vaccination, to share best practices and innovations, and to advocate for the role that pharmacy can play in improving access to vaccination services. I would like to remind you that you can actually access all of the recordings from past events through the links that you find on our digital events website. And again, the knowledge from there is of extreme importance for people living or practicing in different countries, because there's a lot of opportunities to share experiences and learnings from those as well. You'll also be pleased to learn about different kinds of partnerships that FIP embarks upon, and I'll share a screen with you in just a moment. But on this slide, the second column there is a series of events that took place in 2020 at the start of the pandemic, where FIP launched its first digital program of its kind called Transforming Vaccinations Globally and Regionally, which addressed the essential, especially at the time, beginning of the pandemic, the essential role that pharmacists play in saving the lives of millions of people through the provision of vaccines. And the program was a three-part series and consisted of many online events. And actually, the following year, there was a continuation of the Transforming Vaccination series. FIP launched a second series, and so just to emphasize the importance of vaccination as a global health priority. And in addition to all of that, in 2021. There were two main publications. The first one was the FIP Vaccination Handbook for Pharmacists, Procedures, Safety Aspects, Common Risk Points, and Frequently Asked Questions, which I'll come into a bit more detail on a couple of slides down. But also we published a toolkit entitled Building Vaccine Confidence and Communicating Vaccine Value, a toolkit for pharmacists, again, providing you with a collection of best practices, providing you with the links to an array of resources that pharmacists from all around the world can access and learn from each other, I should say. This slides here highlights some of the organizations that FIP is proud to partner with in the area of vaccination, because we believe at FIP that partnerships are crucial to advocate for a broader role for pharmacy in vaccination. So over the years, FIP has proudly collaborated in joint efforts with several organizations listed on the slide, with those that have aligned agendas with us in the area of vaccination. And we work differently with these different organizations, whether it's advocacy, policy statements, joint events, and webinars. And a lot more detail is available on our prevention microsite. I invite you to explore those as well. Additionally, at FIP, we are able to work with experts in the field from all around the world to develop policy documents and statements to support with policy making on a country level, where we encourage our members to approach these with an adopt and adapt philosophy, whereby considering contextual factors and circumstances to support them in advancing vaccination policy and any planning efforts in that field. It really is to aid or to help national ministries as well of health and regulators, National Pharmacy Organization in assessing overall vaccination programs, the state of legislation, regulation within their countries, and to facilitate vaccination and enhance patient care through the pharmacy workforce and specifically community pharmacies. So these are tools that really can help with vaccination planning and the utilization of pharmacy workforce in primary healthcare and community-based vaccination programs. And I guess what's really then important to really hone in the coming kind of couple of slides is the importance in providing pharmacists with adequate training and professional development opportunities so that pharmacists can achieve their competence and their proficiency to perform a series of roles that can significantly contribute to improving vaccination coverage. As I said to you, we've learned a lot about evidence-based advice and services by pharmacists, and it is really important for a lot of our members to equip pharmacists with the right set of skills to deliver those services and improve them where possible. And the way we do that is by ensuring that adequate education and training is available and is provided for the effective performance of the roles of pharmacists as part of not only foundation training, but also as part of postgraduate or continuing professional development opportunities. As you can see where I've highlighted in yellow, the importance then of ensuring that we have mechanisms to develop competency for vaccination delivery and the related roles as part of undergraduate education, as well as CPD pathways where possible. Of course, all of this needs to be supported by regulatory frameworks, policy, legislation, and appropriate scopes of practice to support pharmacists deliver these services. So, as I mentioned to you just 5 minutes ago, that in 2021, FIP developed the FIP Vaccination Handbook for Pharmacists. And this handbook helps pharmacists to really maximize disease prevention roles, really making sure that every contact with patients actually counts is a message from FIP through these publications. The handbook details the many ways in which pharmacists can contribute to improving vaccination coverage, such as supply chain, stock management, storage, record keeping, the facilitation of opportunities, and administration of vaccines. But it also gives emphasis to their important educational and advisory role. And therefore, having said this, we recognize that not all of the roles that are described in this handbook, for example, are currently open to all pharmacists or to pharmacists in general in every country. We understand that there is disparity, and we understand that there is a variation in service provision levels. Therefore, this handbook aims to support the expansion, the advancement, the development of these roles of pharmacists in order to increase vaccination coverage across the globe. And as evident, we know that pharmacists are very well positioned in communities to provide vaccine-related services. And this variation across with the scope and the content that's available to them for training programs, for example, means that often that we might require support to do this more effectively. And that support, we believe, is now available from FIP in the form of a supportive reference guide published in 2022 titled the FIP Vaccination Reference Guide, Knowledge and Skills to Support Professional Development and Inform Pharmacy Education in Vaccination. This is the cover page appearing on the right-hand side of your screen, which works in tandem with the handbook, which is on the left-hand side of the screen. This reference guide, which we are very proud to have launched in 2022, as I said, has two main foci. The first focus is on ensuring that undergraduate education and training is designed in such a way that the future workforce is ready to provide vaccine-related services upon graduation. But the second one is focusing on the currently active workforce with the intention to support the comprehensive CPD, advancing the knowledge and the skills of practicing pharmacists who provide those preventive healthcare services, including immunization against vaccine-preventable diseases. And specifically, in the context of our conversation later today, also focusing on those patients that live with other comorbidities, such as diabetes, for example, or cardiovascular disease, and the importance of vaccination in those risk populations as well. We really believe that this guide was created for the benefit of all. Educators, academic institutions, member organizations, practitioners in the field, CPD providers, even CPD providers and creators of courses, if you like. It really outlines, in summary, the knowledge and the skills that should be acquired by the pharmacist or by the pharmacy student, if you like, through professional development and training. And it becomes a very useful resource to develop courses where they maybe don't exist yet. And so we're very happy to share this with you and hoping that you're able to explore it further. The Knowledge and the Skills Reference Guide links to other frameworks at FIP, such as the Global Competency Framework. It gives you a table of knowledge statements, as well as a table of associated skills, and provides little guidance on course development and self-learning, as well as emphasizing the importance of the adopt and adapt approach when looking at these guides or using them. I invite you to scan the QR code here to learn more about the knowledge and the skills in the area of vaccination. Additionally, in other ways that FIP supports enhancing the workforce knowledge and skills in the area of vaccination. As I mentioned to you, the importance of partnerships. And we have a program at FIP called the Provision Program, by which we're able to attract quality continuing professional development, educational postgraduate programs that could be of use, address some of the needs and priorities of our members, to perhaps adopt, to utilize, to collaborate on. And we do this in a number of ways. But what I'm sharing with you today on the screen is the FIP Seal for Programs. And the FIP Seal for Programs is a visible sign of quality provision. And I'm happy to share with you that amongst the number of programs that have been awarded the FIP Seal since the inception of this iconic program in 2021, we have two 2 programs that come from members and partners. We have one program titled Vaccine and Injectable Medicines Administration, provided by ANF, the Portuguese National Association of Pharmacies in Portugal. And we also have a on-demand flu vaccination uptake and coverage course provided by OmniCurious. And I invite you to go to the provision microsite, which I will add in the chat box in just a moment, but it's provision.org.fip to learn more about these courses and how you can enroll in them if you are interested. In addition, we created a new model to provide professional development opportunities for pharmacists, and we titled this FIP CPD Bites, where the bites provide or offer concise and evidence-driven professional development opportunities using a variety of learning activities. These include information sharing, knowledge and skills-based activities sometimes, and they are designed to be short and sweet bites and prompt access to further CPD. And participation in these CPD bites may contribute to our CPD portfolio through the acquisition of new knowledge, improving new sets of our skills in a particular area. In Vaccination and Special Risk Groups was a series of 6 videos exploring the role of pharmacists in vaccination, was produced by FIP, and I'm sharing on this slide the webpage address on the top there, how you can watch these recordings, 6 of them, and they looked at vaccine preventable diseases in special risk groups. So I invite you to explore those. Additionally, stemming from this series, the GSK series, which FIP has collaborated on, we will be producing 5 CPD bites that will be launched later in November, and they are coming soon. But you can watch the recordings of these events on our events.fip.org website. However, what we want to do for the convenience of our members and the wider profession is repackage those for you and form 5 mini CPD bites to support your professional development. 2 of those will delve into, as Lena said earlier, the technical and the evidence-based insight on positive downstream effects of vaccines in older adults, including cardiovascular disease, diabetes or arthritis. And there'll be 3 mini episodes that we will curate from those events, where 3 experts shared contributions, activities, tools that pharmacists lead and utilize to promote healthy aging in the practice setting. I am grateful to have been able to provide you with this overview and also some of the work that FIP is proud to have led over the years in the area of vaccination and what's coming up next as well. And I would be very happy. I'll stay on the call to answer any questions you may have in the chat box for a few minutes. And I will also add a couple of links to our resources for your at your convenience to click on when needed. But thank you so much, Lena, colleagues, for having me today. I hope that provided everybody with a good overview of the topic at hand, but also of FIP's support of vaccination-led activities and initiatives. Thank you so much, Lena. And I think I'll give the floor to you.
Thank you so much, Dalia, for that very comprehensive overview. We do need to do this every once in a while, remind our members what we're working on, all the tools we develop to serve them advanced pharmacy locally, regionally, and globally. So thank you so much, and we're all looking forward to the CPD Bites, the ones coming up. Again, thanks for staying on the call. I'd like to invite our esteemed panelists, Eric and Nicola, to go on camera to begin our panel discussion following all of the series, Dalia's input, so much context to build on. So I just wanted to start by introducing you first, both of you. So let's start with Eric. So Dr. Eric Jaeger is an associate professor of microbiology and chair of the Department of Allied Health Sciences at the Albany College of Pharmacy and Health Sciences. He's joining us from the USA today. At the college, Dr. Yeager instructs several courses in the life sciences and serves as program director of the college's pre-pharmacy program. As a member of the college's STAC Family Center for Biopharmaceutical Education and Training, Dr. Yeager is involved in student instruction and the development of vaccine workshops for workforce training. Dr. Yeager has 20 plus years of experience in the areas of virology, immunology, antibody-based therapies, and vaccines, and has authored more than 25 peer-reviewed publications. Eric, thank you so much for joining us. We're really pleased to have you.
Thank you, Lena. Appreciate it. Hello, everyone.
And moving on to Nicola Veronese. He is a certified trained geriatrician, currently working as a senior researcher in geriatrics at the University of Palermo, Italy. His research is mainly epidemiological and focuses on the most common diseases affecting older people. In particular, his interest areas are osteoarticular, metabolic, and cardiovascular diseases, as well as nutrition and vaccination. He's the author of more than 600 articles published in national and international scientific journals and of numerous abstracts accepted by national and international congresses. Welcome, Nicola.
Good afternoon, everyone. Thank you so much for the invitation. It is a big pleasure to be here.
Thank you so much, both of you. It is really, truly an honor and pleasure to have you both. So I've tried to devise some questions that both tailor to your expertise, but also still link to the wider topic. So I'm going to start with you, Eric. In your role as a microbiology expert, could you share insights into the downstream impacts of vaccination on microbial ecology and antimicrobial resistance? And how are these aspects connected to disease burden and public health?
Thank you, Lena. Appreciate kicking things off here. I think it's important to, working off of what Dalia's presentation showed, is just highlighting the importance of vaccination against global disease. Thinking about flu, measles, polio, smallpox, these different diseases throughout history, that vaccination has played a critical role in either eradicating, like with smallpox, or continuing to treat and almost perhaps eradicating with polio. In terms of using my expertise as a microbiologist, I think it's important to think about the different therapies and preventive measures that we have. So we're all aware of antimicrobial resistance and antiviral drug resistance that can arise. This is a little less common with vaccines. And I think that gets to the point of how vaccines are developed. Scientists work to identify those targets of the pathogen that are highly conserved and very important for that pathogen. So fortunately, for a number of vaccines, that research has identified those targets, or in some cases, multiple targets. So the emergence of vaccine resistance is fortunately quite rare. I think where we have to look for is in terms of both the public perception of vaccines that might drive that. And what I mean there is the idea of herd immunity. So if there are some pathogens, of course, that can evolve like viruses, RNA viruses like COVID and influenza, they do mutate quite readily. So it's important to keep our vaccination levels high, because every time a pathogen gets to infect an individual, there's a chance for that pathogen to mutate or evolve. So I think one of the ways to kind of prevent that downstream is just by improving vaccination rates. Certainly we have viruses like influenza that certainly do mutate, but fortunately we do have vaccine approaches that allow us to deal with those mutations in quick fashion, particularly now that we have mRNA vaccines. I think it's also important to realize that from both the pharmacist level is kind of relaying some of these informations to individuals that they deal with. Pharmacists being one of the most accessible individuals or healthcare providers is very important to kind of alleviate some fears about, some people might think, well, why should I get a vaccine if the pathogen's evolving and the vaccine no longer works? So I do admit it gets a little bit deep sometimes trying to convince, what vaccine efficacy really means. But it's important to stress, I think, that most vaccines that we have worked quite well against a variety of pathogens. For flu example, preventing hundreds of thousands of hospitalizations, dramatically reducing hospitalizations and ICU admittances. And as I'm sure Nicola will discuss, again, against these special populations, is that, yes, there are some pathogens that really evolve quite quickly, but the vaccines still have been quite stable, very effective against these pathogens.
Thank you so much, Eric. I'd like to move on to ask Nicola a question. And Nicola and Eric, you can both stay on video for the whole discussion. So Nicola, you have extensive expertise in geriatrics. How do common diseases affecting older adults relate to the broader objectives of understanding disease burden and vaccination impact?
Thank you, of course, for the question, because in my opinion, it is of importance. So I believe that several diseases are typical of older people, from cancer to cardiovascular disease to dementia. And it is, of course, hard to say how they may relate to the broader objectives of better understanding disease burden and finally vaccination impact. Maybe I can do the example of dementia, because it is of my daily clinical practice. So my feeling about that is that people affected by dementia are often felt as really frail, probably the most frail people that we have in our clinical practice. But at the same time, so we have, for example, for the influenza vaccination, but not only, a lot of data saying that vaccination are extremely important for these people. The literature part, but from the daily clinical practice, for example, general practitioners and nurses have a lot of difficulties for giving this kind of vaccination to people affected by dementia. For example, the informed consent, relatives, of course, fears, frailty, and very many hard. Therefore, in my opinion, it is very important to have some meetings, for example, like today, but not only, in order to convince health professionals, caregivers, families, regarding about the importance of vaccination in older people, of course.
Thank you, Nicola. And of course, it's very common for older people to have comorbidities. So it's usually dementia and requires the complex an approach to a complex issue. Thank you so much, Nicola. Eric, moving on, I know I'm doing like a bit of a ping pong here, but hopefully by the end we'll come together to a very common conclusion. But given your leadership in the Department of Allied Health Sciences, how, in your opinion, can academic institutions contribute to enhancing the understanding of vaccination's broader impact and improving resource utilization and implementation strategies?
Thank you. I do feel like tennis, but this is a lot of fun. Thank you. I think importantly, we need to have these institutions keep being dedicated to preparing educated and well-caring professionals. That includes pharmacists, that includes clinicians, and even researchers. So I think just keeping the important resources towards the basic and clinical sciences is going to be very important. I think from an educational sense, from my own experience at the Albany College of Pharmacy and Health Sciences, is we do have many of those programs, and it warms me to see that in our local community, there's so many students that really want to make a difference. So kind of stressing the importance of STEM, stressing the importance of healthcare. I think seeing these students come in and really wanting to make a difference, that gives me hope that we'll continue to be able to continue that mission of educating and putting out there very proficient and caring professionals. I think part of that education process is events like this is to stressing to those students. I say students not only as they're getting their degrees, but also with continuing ed like this, is stressing the importance of vaccination. Along with that is how vaccines work, how the immune system works. I think that helps to educate our patient population. Importantly, understanding some level of how the pathogens work. Importantly, how to understand some of the disease states. I think really incorporating infectious disease and maybe approaches like vaccination and how they can protect against the pathogen, but also the other complications that Nicola mentioned. It's also important to stress too in this education process, the importance of understanding that health disparities exist, they exist globally, and that vaccines need to be made accessible. So again, educating the population about how we can do that in a variety of levels. I think too importantly, as I mentioned earlier, in terms of trust, I think these professions such as pharmacy, nursing, medicine, and myself being an immunologist is we are trusted individuals, is to using that information that we have to combat the unfortunate rise in disinformation and misinformation globally. So I think that has to be incorporated also into our education processes to teach our young professionals how to become trusted, how to communicate well, how to combat what's out there, to again continue to stress the importance of vaccines.
Thank you, Eric. Absolutely. I think trust is completely critical for even explaining anything, and even more important for addressing hesitancy and misinformation. I'm going to stay with you because we're just talking about education, and my next question is still linked to that, but more broadly addresses research and the role of universities. But can you tell us more about what you think is the role of research and education in promoting vaccine management proficiency or efficiency? And what strategies can universities and maybe schools of pharmacy implement to further support this?
Yeah, great. Thank you for that follow-up question. I think, again, understanding the aspect of how vaccines are made in the process, it doesn't need to be a granular understanding, but at least I think a foundation of understanding the processes and challenges that exist with vaccines, and that equips our providers to answer some of the questions. If I think back to when our COVID-19 vaccines were first made available, like we wanted them like tomorrow, and it just eventually came across, and then some places of the world they weren't made available right away. But trying to explain to individuals, what's the process? Why is there a delay? So I think understanding a little bit about the fundamental aspects of production is important. I think other types of research that are needed, certainly basic research on how vaccines can be better delivered. The biology of the vaccine, certainly for those individuals that are more involved in the basic research. But I think it's also important in research to understand public perception, to design surveys that, again, globally can understand what are those underlying maybe mistrust or perceptions that can be addressed. Importantly, too, good modeling. We need to have great data to understand when a vaccine is produced, how effective is it? We certainly have the effectiveness in a clinical trial versus the effectiveness in the real world. So I think research-wise, again, irrespective of what major a student is studying for, if they're doing microbiology like our college offers or pharmacy like my college offers, I think there's opportunities for both populations to get involved in research, both on some aspects of how the vaccines work, but importantly, on how to communicate the benefits and also to do some statistical analysis to understand those benefits that can be conveyed to the patient population.
Thank you so much, Eric. Moving on to the other side of the court, but still staying on research with Nicola. So Nicola, in your epidemiological research and findings, have you observed specific trends or outcomes related to vaccination among older populations that are worth highlighting here to strengthen, resource utilization and implementation?
No, thank you so much for the question. Of course, I mainly dedicated my research regarding the importance of influenza vaccinations, but not only, but mainly dedicated to flu and influenza. For example, last year we published a systematic review with meta-analysis of several cohort studies, practically showing that influenza vaccination was associated with a lower risk of dementia and cognitive disorders of about 29%. Of course, in this direction, we published some years ago an umbrella review regarding the importance of flu vaccination in order to show that also in older people, we can prevent cardiovascular disease, in particular major cardiovascular disease, and we have a really limited and banal, I can say, side effect. And finally, in the last month, we published one work regarding the factors that may affect vaccination for influenza, for pneumococcus in the Shell study, a very large European study, practically indicating that in people that are poor or affected by poverty, the factors could be very, very different compared to other socioeconomic levels. In my opinion, so I hope, of course, that these findings could be of importance for everyone in order to better understand how to integrate research, epidemiological research in this case, to clinical practice every day.
Thank you so much, Nicola, for highlighting these examples. That's really great. Another question to you, Nicola, still on research, but how can research in the area of geriatrics contribute to a more comprehensive understanding of vaccination's downstream effects? And what implications does this have for healthcare policies and practices?
Sure, thank you for the question. Of course, As everybody, I believe, knows, we are in the middle of the decade of healthy aging promoted by World Health Organization. And this is, in my opinion, important to sometimes at least to remember that we have healthy diet. This is important. We have physical activity, but we have also a solid literature about vaccinations. As a geriatrician, I really feel that vaccinations are important from children to adults, in other people, in order to prevent not only the specific diseases, of course, that are for importance, for example, pneumonia, but also other diseases, for example, cardiovascular, cerebrovascular disease, stroke, and so on. My opinion, my final opinion regarding the next step for the future is to try to integrate epidemiological research that is of importance with translational research. For example, we don't have at least clear if vaccinations are able to prevent disability, and so which are the main mechanisms, pathways that are of importance. My opinion, this is the next step to move forward.
Thank you so much, Nicola, for that. And I think upon highlighting the example of dementia, we've had a comment from one of the participants saying we should do a webinar on Alzheimer's disease and shed light on how to manage that condition. So thanks for that inspiration. Eric, I want to talk to you about multidisciplinary practice or education and its role in this. So, you know, you're the chair of the Allied Health Sciences, which naturally means all of the health sciences together. But are there any case studies or examples from your experience that showcase the importance of a multidisciplinary approach in this agenda?
Yeah, thank you for that question. I think one of the most impactful experiences for me, and being it so recent, was you know, the start of the pandemic. It was heartening to see again faculty and students come together, all, you know, kind of all hands on deck, if you will, and each of the individuals, and this is not just faculty, but students too, using their area of expertise and areas of passion to really spread information and really to stress the impact that vaccination can have. So we had pharmacists, certainly my pharmacist colleagues, and the college has a number of student-managed pharmacies in the community. We're able to use that as a contact point for many populations that were at risk for COVID. So there was traditionally different populations, as Nicola mentioned, you know, older individuals perhaps without access to maybe insurance. So we're trying to reach those individuals that really were being impacted by the disease. So the pharmacists played an important role to give us that inroads into communicating the benefits of the vaccines. That involved it also our public health professionals. We have a large number of individuals on campus that are committed to public health. So they helped us craft messages and to reach those community members. So once the vaccines were made available, the population felt comfortable getting them. And coupled with that too, we have our basic science faculty. Me being a virologist, I could utilize my expertise again to help shape that message of how we can stress to the population that vaccines are important, and importantly too, to alleviate some of their concerns. Certainly locally, and I'm sure globally too, there's still, again, some misunderstanding or misinformation about vaccines that unfortunately has just increased. But again, as I mentioned, kind of all hands on deck, coming together, really making a difference in our local community. And I think that raised, fortunately, the perception locally in the capital region in New York of the college. It raised the perception of these different professions. But I'm hoping similar things happen globally, that there are individuals that are dedicated to educating the population to make sure that these vaccine initiatives that have been so important for decades will continue to be important.
Thank you so much, Eric. I'd like to ask both of you maybe one question, and we're very pleased at FIP to have non-pharmacists join our events because, again, it's so important to hear your perspectives on this. But to both of you, Eric and Nicola, as immunologist/virologist and geriatrics expert, respectively, what would you tell us as FIP, as a global pharmacy organization? What should we focus on? If you could tell us to focus on one thing. Nicola, I'll come to you, Eric.
Sure. So only one thing: education. my opinion, is the most important thing, because we cannot empathize so to convince using, I don't know, weapons people to get vaccinated. This is, in my opinion, the most important thing. To educate with the transparent data, of course, but education is the most important thing, absolutely.
Thank you, Nicola. Eric, I have a feeling you very much agree.
Yeah, definitely echo what Nicola's mentioned. I think kind of along with that too is just continuing to foster collaborations. I think these professions no longer exist in silos, and there's so much interplay and teamwork in healthcare now. With limited time and resources, it's really important to bring in other individuals that can really help things along. So I would just stress to FIP to continue their great work at collaborating and advocating for not only pharmacy, but healthcare in general.
Thank you, Eric. And whatever we do is only possible with the input and collaboration of people like you. I'd like to thank you both for your time, for being on this webinar. I know it's very early for you, Eric, and you're taking time out of your schedule, Nicola. So really appreciating your time. Thank you so much for joining us. And I'd like to thank Dalia Bajes, who has also participated in this, and all of our joiners from all around the world. And another thanks also to the FIP team behind delivering the event and all the event logistics. Thank you so much, and we hope to have you again very, very soon.
Thank you very much. It's been a pleasure.
Thank you very much also from my side.
Thank you both. Take care, everyone. And you may access this webinar on events.fit.org. It is also being live streamed on YouTube, so you can access the recording for free on there. Thank you and take care.